My name is Brittany Morgan, and I'm a PhD candidate. And so today I'll actually be discussing gaps within research involving Indigenous patients. So are standard guidelines enough? Oh, there you go. So first off, I would like to take a moment to acknowledge a few people. So my supervisor, Dr. Laura Arbour, and the Silent Genomes team, particularly my office mate, Sarah McIntosh, who's always answered all my questions, and members of the International Indigenous Genetics Advisory Committee. So members, Doctors Phil Wilcox from New Zealand and Miley Tawali from Hawaii, as well as all the Indigenous presenters at the same 2020 conference in Hamilton, New Zealand. Nigel Livingstone in Livingston for patience as a professor has been much appreciated, and Betty Taylor for helping me develop the proposal for my practicum. And lastly, but not least, the creator, my family, friends, and community who've always supported my endeavors. So a little bit about myself. I am Nuu-channel from my mother's side and a member of the Toquot Nation. And on my late father's side, I am Shuswap with family ties to the Bonaparte Indian Band. So I'm the youngest of 6 daughters, so the baby, as you can guess from the top left photo. And this year, I even had the privilege of traveling to New Zealand with my mom and fiance. And the photo on the bottom right is a photo of us at the Hobbiton set. And at the top right is my fiance and puppy, who've always been my largest supporters. So short outline, but lots to discuss. I will start with the introduction of my practicum placement, and for the majority of the talk, I'll actually be reviewing the recommendations that came from our report to improve Indigenous genetic and genomic research, as well as the gaps and uncertainties that contributed to these recommendations. And hopefully I'll be able to review a few Indigenous-led international guidelines from New Zealand and Australia. So my practicum was with the Silent Genomes Project, which is a Canada-wide initiative with the goal of reducing healthcare disparities and improving diagnostic success for children with genetic diseases from Indigenous populations. So the project is about equity and addressing barriers to improve genetic and genomic research. And as you can see from the figure on the right, the project has 4 activities that are all interconnected with activity 1. So ensuring Indigenous-led governance over biological samples and health data. So my practicum fit into activity 2, which is the precision diagnosis of Indigenous children with genetic disorders. So starting with the figure, activity 2, precision diagnosis, actually consists of 15 national clinic network sites, so NCN sites across Canada. And each genetic unit has a team of champions, so who are well informed of the importance of genetic disease for research is patient-based genetic and genomic research. So working with individual patients who have an undiagnosed but suspected genetic condition who are invited into the study to try and find their diagnosis. So they are accessed through health clinics or hospital-based. So my practicum was analyzing the gaps and uncertainties in patient-based genetic and genomic research involving Indigenous peoples. So this required reviewing national and international standard research guidelines, as well as evaluating Canada's guidelines to comparable initiatives around the world. So there were great Indigenous-led examples that have been developed in New Zealand and Australia who are really leading the way of indigenizing genetic and genomic research. So let's start reviewing the recommendations. So the first of the recommendations is actually increasing the number of Indigenous Research Ethics Boards, so IRABs, as well as the development of a national IRAB. And so the gaps and uncertainties that were discussed in my report is that standard Canadian guidelines, such as the Tri-Council Policy Statement 2 or TCPS2, and the Canadian Institutes of Health Research, so the CIHR, with regards to Indigenous health, put an emphasis on community-based participatory research, so CBPR. And before I step on my own toes, CBPR is an excellent approach to research to ensure that researchers are partnering with communities as equals in all stages of research. However, patient-based research is not always going to be in community. And referencing back to those NCN sites for the Silent Genomes Project will involve patients from many communities across Canada. But referencing wise words from one of our co-leads, Dr. Nadine Caron, is that patients have families and families have communities. So PBR approaches kind of lack the importance of those family and community supports. And if the PBR genetic and genomic is hospital-based without Indigenous oversight, such as IRAB, patient-based consent does not really provide those protections, such as ensuring that researchers are following community governances and protocols. So the fallback is for PBR is that it's reliant on these standard guidelines. So recommendation 3 and 4 really bring up individual autonomy in that Indigenous peoples have the same right to participate in research as any non-Indigenous person, but identifying their community shouldn't be a requirement. So what I mean by this is when research involves Indigenous peoples, self-identification is often required, so community identifiers. So although self-identification as Indigenous, so Inuit, Métis, or First Nations, may be a requirement for certain research, the disclosure of a specifically named nation or community, so I would be either Toqua Nation or Nuu-chah-nulth, needs to be discussed more fully within research guidelines, and because of this specific community affiliation, should not be included in publications, which leads us to our fourth recommendation, is that individual consent is not community consent. So if community identification is needed, then it should actually activate a second safeguard protocol where community engagement is required. So in this figure here, CBPR and PBR are somewhat connected rather than compartmentalized, as Western frameworks do, because Indigenous genetic and genomic research is unique because an individual's genetic material not only contains information about themselves, but also contains genetic components passed down for many generations, and in turn can reveal information about an Indigenous community or population. So although there are standard safeguards in place for CBPR involving Indigenous peoples, there is a lack of patient-based protocols and guidelines. So a recommendation to kind of guide this transformation could be the inclusion of a standard operating procedure protocol document for genetic and genomic research that could be adapted by communities to fit their priorities and perspectives. This document can be an addition to the TCPS2, similar to how the CHR guidelines included this research agreement template in their appendices. So before we continue on to the last few recommendations, I did want to share a couple of Indigenous-led examples from New Zealand. So the first being the Te Aratika guidelines, which are guidelines for Maori research ethics, and were included in the national guidelines for research involving Maori, so New Zealand's CPS2. And from that became the development of the Te Mate'ita guidelines, which are specific to genetic and genomic research. So both guidelines were actually based on traditional values and ways of the Maori and grounded in Maori language. And they also share this model of health and well-being, which really reminded me of the Indigenous medicine wheel. But I wanted to highlight one component, and that is the inclusion of extended family and community support, which is important when discussing these levels of engagement in research. So in this Maori ethical framework, I'll just quickly review the importance of these various levels of engagement and talk about one component. The justice and equity component, or the mana, which discusses the power and authority in individual and collective consent, and it's divided into three parts. So we have minimum standards, good practice, and best practice. So the minimum standards, or that outer ring, are expected to be met by all researchers. So that outlines that individuals have the right to participate, but must be informed of the individual and collective, so the risks and rights. For good practice, or the middle ring, indicates a more Maori responsive approach, that the family and tribe actually have roles in decision and resource management and have a greater level of participation. While in best practices, the center, that aligns with Maori culture. So it's the sharing of power and control is also with the family and tribe, and the tribe's knowledge systems and ownership of data are acknowledged. So these guidelines demonstrate that interconnectedness of individuals, families, and tribes, and how these relationships actually minimize harm as well as supporting resources for genetic and genomic research. So Australia, also ahead of the game, has a specific genetic and genomic guidelines for Aboriginal and Torres Strait Islander peoples of Queensland, which is brand new and was just published in late 2019. So this genomic partnerships guidelines also highlights those levels of consent, so individual family, and individual and community consent. Australia also produced one of my favorite and unique guidelines that I came across, and that was the Keeping Research on Track, because it caters to empower communities. So amongst all the national and international guidelines reviewed to improve Indigenous research and researchers, there is an imbalance of guides created for communities and patients. And it's unfair because it's assuming communities and individuals are experts in research. So this booklet actually familiarizes people with the stages of research, including making decisions about their health, and their values and priorities. So recommendation 6 is the development of a community and patient guides that outline the rights and responsibilities. So I took this segment out, which provided questions divided into questions to ask ourselves, but be easily adapted to questions we ask as a patient, as well as questions to ask researchers. So an example could be like, what safeguards are in place for my sample and data? lastly, we have come to the end. So there is a need for Canada to develop our own guidelines for genetic and genomic research with Indigenous peoples and to discuss these unique issues. And this will require more research to explore these gaps and uncertainties. So to conclude, I would like to end with a quote from the late Dr. Frank Ducapu, who was an Indigenous geneticist, who said, "To us, any part of ourselves is sacred. Scientists say it's just DNA. For an Indian, it's not just DNA. It's part of a person. It's sacred with deep religious significance. It's part of the essence of a person." So thank you for attending, and I'm open for questions.
Thank you very much. Excellent. That was fascinating. I have a quick question for you before the hopefully some members of the audience will ask questions. And that is, can you give me some idea of sort of the incidence of some of these genetic diseases that are sort of being investigated? Are they fairly low incidence, I assume?
I guess, yeah, they would be rare, but when you really think of the collectiveness of rare conditions within Canada, it is pretty high. Specifically for the Silent Genomes Project, I'm not sure if you can hear me. Oh yeah. Specifically for the Silent Genomes Project, we're actually not looking at specific like genetic conditions. Just because they are rare and right now they're undiagnosed, meaning that patients that have come through the Silent Genomes Project have already accessed all the information that they can within the health system. So it would require like more intensive like whole genome sequencing, if that's the question you had.